Dear friends, suddenly your head feels tight, your vision becomes blurry, and an unexplained pressure overwhelms you with that headache. If you dismiss this as just being tired, it can be really dangerous. Doctors say this: all chronic pressure headaches have a reason, and that reason manifests completely differently in women and men. Today, we will explain the 5 main causes of chronic headaches and pressure sensations, most commonly found in actual clinical practice, and the differences between women and men, accurately and clearly. By the end of this video, you will understand exactly why your headache occurs and how to manage it properly. Headaches common in women. The first cause is hormonal changes and decreased vascular response after menopause. Women experience a sharp decline in hormonal regulation, which affects vascular elasticity, temperature regulation, and overall nervous system stability. Typical symptoms include a dull tightening sensation around the head, heat rising from the face and head, pressure crawling from the back of the head to the crown, headaches that wake you up in the middle of sleep feeling foggy. This is not simple stress, but a state where vascular reactivity has decreased. The characteristics are very clear. It worsens as the afternoon progresses, sensitive to weather and atmospheric pressure changes, accompanied by emotional changes and autonomic nervous system symptoms like flushing and palpitations. More than half of women's headaches fall into this category. So why are women more prone to these headaches? It is because of a hormone called estrogen. Estrogen keeps blood vessels soft, regulates body temperature, and stabilizes nerves. However, after passing through menopause, this hormone decreases rapidly. Blood vessels become stiff, temperature regulation fails, and nerves become sensitive. Therefore, even when experiencing the same stress, women often develop pressure-type headaches that feel like the entire head is being squeezed. The reason it gets worse in the afternoon is that the fatigue accumulated throughout the day further reduces vascular regulation function. The reason headaches worsen on cloudy or rainy days is also here. When atmospheric pressure drops, blood vessels expand. But in a state of hormonal deficiency, this expansion cannot be properly regulated, and pain occurs. They are also sensitive to emotional changes. When stressed or angry, the autonomic nervous system fluctuates, and headaches appear immediately. Such headaches are difficult to solve fundamentally with painkillers alone. Hormone balance and vascular health must be managed together. Menopausal symptoms and headaches are closely related. Hormonal changes disrupt the balance of vascular constriction and expansion. Maintaining a regular lifestyle rhythm is the most important prevention method. Especially keeping sleep times consistent greatly improves symptoms. Go to bed by 11 at night and wake up around 7 in the morning. Develop this habit. Avoid smartphone use before bedtime. Keep the room temperature comfortable, dark, and sleep in a quiet environment. Bedding is also important. Choose a pillow height that does not burden your neck. Headaches common in men. The second cause is vascular headaches. Blood pressure, blood flow, and sugar metabolism problems are the core. For men, vascular system changes are the core cause of headaches. Typical symptoms include heavy head in the morning, pressure behind the eyes, deep pain between the eyebrows, symptoms that worsen after greasy food or alcohol. These headaches occur when blood pressure changes, decreased blood flow, and rapid blood sugar changes influence each other. In fact, many male patients with chronic headaches, when measuring blood pressure during pain, find it is 10 to 20 millimeters of mercury higher than usual. If left untreated for a long time, it can lead to the most dangerous microvascular brain damage, so accurate management is necessary. Men typically start losing vascular elasticity from their 50s onwards. As cholesterol and triglycerides begin to accumulate, the inside of blood vessels narrows and hardens. Then the heart must pump more strongly, and that pressure is transmitted to the brain, causing a heavy head and throbbing pain behind the eyes. When overeating or drinking is added here, blood sugar rises sharply, blood becomes sticky, and headaches worsen further, especially if your head feels heavy and not refreshed when you wake up in the morning. This could be a sign that blood pressure or blood sugar regulation did not work properly during the night. Also, throbbing pain behind the eyes means cerebrovascular pressure has increased. If this state repeats, microvessels become damaged, and later the risk of cerebral infarction or cerebral hemorrhage may increase. The same applies when the deep part of the eyebrows hurts. This is a state where vascular pressure on the frontal lobe side has increased. The reason headaches are severe the day after eating greasy food or drinking alcohol is that blood lipids and blood sugar change rapidly, placing a burden on blood vessels. Men with such headaches must regularly check and manage blood pressure, blood sugar, and cholesterol levels. Vascular health is directly connected not only to headaches, but to overall health, especially for preventing cardiovascular disease. Vascular management is very important. Small changes in daily life bring great improvements. Make morning walks a habit. Use stairs. Start with simple things. For meals, focus on vegetables. Actively consume fish and legumes. Reduce salt intake. And get used to light flavors. Avoid processed foods and instant foods. Dear friends, if this helps you, subscription is love. You know, right? You know subscription is love, right? Headaches common to both women and men. The third cause is neck and shoulder, myofascial tension, and temporomandibular joint problems. The absolute majority of senior headaches recently fall here. Stiffness in the back of the head, pressure in the temples, headaches that alternate left and right, pain accompanied by eye fatigue. The causes are almost simultaneous. First, myofascial tension. When smartphone use, lowering the head. Stiff shoulders continue. Neck and shoulder muscles stimulate the nerves in the head. Second, temporomandibular joint and masticatory muscle tension. When stress accumulates, you clench your teeth. At this time, all the nerves in the head become tense. Women have more sensitive fascia. Men have more pronounced stress-related jaw muscle tension. Especially recently, more people are looking at smartphones for long periods. The turtleneck posture, where the neck and shoulders bend forward, has become common. When this posture continues for a long time, the muscles on the back of the neck remain constantly tense, and that tension stimulates the nerves on the back of the head, causing stiff and heavy headaches in the back of the head. There are nerves that go up from the neck to the head. When these nerves are pressed by muscles, pain spreads from the back of the head to the crown. Also, when stressed, you unconsciously clench your teeth or put force on your jaw. At this time, the temporal muscle around the temples becomes taut, and pain that feels like temple pressure or migraine appears. Such headaches often do not respond well to painkillers because it is a muscle and nerve problem. Also, when using eyes for a long time, the muscles around the eyes become tense, and this tension spreads to the forehead and temples, causing headaches, especially if you have a habit of grinding teeth at night. When you wake up, your jaw is stiff and temples hurt in many cases. For such headaches, stretching, jaw relaxation exercises, and posture correction are the most important treatments. Desk work or prolonged smartphone use is one of the biggest causes of modern headaches. Just taking a break every hour and moving your neck and shoulders has a great preventive effect. Warming the neck with a heated towel is also effective. Chair height and monitor position are also important. Adjust to a height where your eyes naturally look forward. Place the keyboard at a position where your elbows are at 90 degrees. Use the mouse so it does not burden your wrist. Do not forget to stand up regularly and stretch your body. Headaches, especially common in men. The fourth cause is sympathetic nervous system hyperactivity headaches. Men often have overlapping work stress, pressure from responsibility, drinking habits, and the nervous system break does not work well. Medically, this is called sympathetic nervous system hyperactivity. Typical symptoms are fine during the day, but head tightens when night comes. Have to press the head, eyebrows, temples to feel better. Trapezius muscles and shoulders hard as stone. Difficult to fall asleep. Not refreshed even after waking up. This state is not a cerebrovascular PR.